everyone. My name is Dan Kuntz, and I'm a sales engineer at Call Tracking Metrics by day, but today I'm serving as moderator here at Demo Day. It's with great pleasure to introduce Lindsay Beasley, a seasoned professional with numerous years of experience in behavioral health. Today, Lindsay will be sharing valuable insights on Sunwave and their new tool, MARA. To kick things off, could you tell us a little bit more about yourself?
Definitely. So I've been in this industry for, I'm going to say about 15 years. Originally started with the intent of becoming a mental health counselor, wanting to, really work with patients. Did that for about 2 years. And, I just have to say, I have such a respect for our clinicians and nurses because obviously I couldn't hang. All right. It was a lot, emotionally, mentally, even physically. And I ended up kind of making a segue into the billing world and did that for a number of years. And Sunwave actually came to me and demoed, and I loved the product. I loved the people and had some thoughts and ideas and ended up working with them 6 years ago and have not left, staying with them strong, loving it here. So yeah, that's kind of me in a nutshell.
Oh, that's awesome. Thank you for sharing that with me, Lindsay.
Yeah,
To kind of get things started, we wanted to ask a couple of high-level questions for you.
sure.
So how does Sunwave's platform adapt to the evolving needs of behavioral health facilities, especially in terms of customizing features, meeting specific operational requirements? How do you do this without the need for complex integrations or modifications?
Yeah. So you said high level question. That was a little bit more in depth.
I know.
No, but that is a really great question. So number one, Sunwave is a single platform, a true single platform. And I'm going to go further into that in the demo. I'm going to go through the entire platform end to end. But Sunwave's platform is actually designed to be highly adaptable to, the diverse and evolving needs of this industry. So particularly with customizing features, making sure we're meeting specific operational requirements without the need for complex integrations. Integrations with things like call tracking metrics is something that we've been doing for years. So that's not considered complex. But having clients from multiple areas, we have, OP clients, we have residential clients, and the difference between them is huge. Our OP locations require things like time management, appointment setting, whereas our detox and residential clients have things that are bedboard based and requiring medications. But since we're a true single platform, we're really able to take into account all of the needs based on the client, not based on our capabilities, since evidently those are endless.
Yeah, absolutely. Thank you for that. And in terms of scalability, how is Sunwave positioned to accommodate the growing and changing needs of behavioral health facilities? How do you introduce new functionalities without disrupting existing operations?
Definitely. So again, just kind of hitting on that single platform, which really puts us in a good position to accommodate the growing and changing needs of behavioral health facilities. Um, Really focused on scalability, and the seamless introduction of new functionalities is something that we pride ourselves on. So we're making sure that when we are adding things like you'll see today, Mara, we're making sure that we're working with our clients and we're not having situations where things are going in and they're not able to access them immediately and work with their clients. And we've seen firsthand what it takes to scale from, let's say, 2 facilities to 10 facilities, which we've gone through with our clients. We know that there's a need for technology to continue, as well as working with that growth path. So some important aspects of that growth is it comes down to communication with our clients. It also comes down to making sure that they're well equipped to handle the system. So really, standing by their side as they're scaling, making sure they have the training they need, making sure that they have the connections they need throughout the system.
Awesome. I love it. Well, I'm excited to learn even more about Sunwave and Mara now that I know it's Mara and not Mara.
Yes, it is Mara. That's what we call her. So yeah, so with that, I will get started and I'm gonna actually move our faces away so I'm not focusing on that. So what I'm gonna do is actually focus on the entire system as a whole. So because we are a holistic system, and I love saying that, especially in this industry, everything that you're seeing here today, I'm going to point out, is Sunwave made. Being that we are a single platform, you are able to take care of that patient from the moment that you touch base with them all the way through, even past discharge into billing and alumni management. Now, obviously, we have a limited time here today, and I want to make sure that I can leave enough time for questions. So I'm going to highlight some key elements of each of these areas from the moment we touch base with the client, documentation, definitely going into Mara and some new exciting things within Sunwave. And then we're going to finish off with the billing. Now, I did state that we are a single platform. However, I want to make sure that I am highlighting that we do have the ability to connect to things like call tracking metrics. So when our clients are signed up with CTM and Sunwave, they're able to receive those phone calls directly within the platform. They don't have to log out, they don't have to go anywhere else, and they can start that documentation immediately. So right here, you're able to see what it might look like once you pick up that phone call, so who that caller is, as well as how did they find out about you. So if you have specific marketing campaigns and you want to make sure that you're tracking those, you can have that all feed into Sunwave from that phone call and full reportability on all of this. Now, obviously, I'm not going to go too in depth with all of those items, and I'm just going to state this a couple times. Should you want to see more about Sunwave, make sure to reach out to us. But as we go through, you'll notice this patient has actually been with us previously. Now, I love highlighting this because this is telling us that this patient has been in the EMR because the information is feeding back and forth. This is not an integration. This is one module. So your CRM feeds into your EMR feeds back. So now I know things like, when did my patient admit? Where did they admit? So when you have multiple locations, how did they discharge? And then right here, you'll see that the patient was actually violent with staff. The reason that I have this in here is because somebody on the EMR side, maybe a clinician, said, hey, this patient is violent with staff, and we need to make sure that if they ever try to come back, that we're going to take the proper steps in order to secure everyone's safety. Now, in separated systems, you're probably not going to have that communication from the EMR back into the CRM. Also, you're not going to be able to see financial information. So maybe this patient has been with you multiple times. And in this case, this patient actually owes us $5,000 from their original stay, whether it was copay, coinsurance, deductible. Because we're a single platform, information from your billing is going to flow right back into the entire system. Now, keep in mind, access is a huge thing. We are going to work with you to make sure that access is granted based off of what each user needs to see. So you'll also notice I actually have a role at the top of my screen. So every single user can have their role that is going to assign the access that they need throughout the system. So if you have an intern or you have somebody who's starting in admissions and you don't want them to have financial information, they don't have to have it. Now, as the patient is making their way through that admissions process, this is what our admissions workflow is going to represent. And this is all going to be configured based off of what each of our clients' admissions process looks like. So whether you're doing a VOB followed by a pre-screen, scheduling travel, or maybe you're doing consents and releases of information. This is all going to represent what your admissions process actually looks like. Now from here, as the patient is moving through each of these stages, notifications are actually going out behind the scenes, letting you know that this patient is now ready for a verification of benefits, a pre-screen, sending out those emails so that they can reroute themselves directly back into Sunwave and begin that process. Now, I'm not going to go through every single form and I'm not going to go through every single tab because this is all configurable as well as the forms. But what I will touch on is something called our patient engagement. Now, what we usually see is that intake times can take somewhere around an hour to an hour and a half, which is a lot, especially when you're trying to get that patient treated. So we came up with the patient engagement where you can actually send documentation, whether it's the patient, guardian, surety, and you can send it via text or email. You can send any document. You can also request for pictures of things like their insurance card or a driver's license so that you have everything ready once they walk in the door. We can also create different packets of information so that, let's say there's 10 documents that they need to complete. You don't have to go ahead and click one by one. You can create those templates so that they will immediately go out to that patient, like I said, via text or email. It's a simple hyperlink. In here, they're just going to place in their verification, which is their last name and date of birth. You'll notice I am not setting up a user profile or going into a separate app. It is as easy as clicking on a link, putting in your last name and your date of birth. From there, they will have complete access to all of the documentation that you made accessible for them, where they can fill them out as if they're in the chart themselves. And then once they're done, simply sign it and it feeds back into Sunwave. Now, what's great about this is that this is not going to create a PDF. This is going to filter through into the chart so that that documentation is readily available. And you'll notice I did not have to download anything. I just simply clicked on a link. And the reason that I really stress that is, especially in this industry, we want to make sure that we're making this as easy as possible for our patients to fill out that documentation and make their way to us as soon as possible. Now, as I've gone through the entire CRM process in a high level, I want to just kind of highlight one thing, is the ability to report on all of this information. So right here, I pulled a report that I saved previously, which you can save any report you built, so you can come back to it at a later date. These are also all exportable. But what I did was I just wanted to look at my referral sources and my outcomes. And something so small as this is so big to a facility because you really want to understand where your patient's coming from and are your referral sources working with you? So when I say that, what I mean is if we took a look and I just wanted to see patients who didn't make it in the door, I can filter that out and I can pull more information over. So better understanding why ABC Detox sent over clinically denied patients. And now I can see that those patients had schizophrenia. So in my case, I can go have a phone call, understand why these patients were sent over, and then I can understand exactly how these patients are coming in or if they need to refer out. So now once that patient has gone through their journey, through that workflow, that's where they're going to be pushed into their chart. So now once they're admitted, they're going to have one MRI number that's going to live with them for the entirety. Meaning if this patient comes back 3 more times, don't worry, I don't have to search every single chart to find them. It is accessible because it is going to connect to one another, which means you can also pull over previous documentation. So we have the ability to actually copy over information from previous documentation, whether it is a form that has been previously filled out or if it's from a previous admission. Now, right here, when looking at my biopsychosocial really quick, you'll notice that we have substance use history. So in the substance use history, we are going to select our copy option. This pulls over all of that information from a previous documentation, like our pre-screen. And I can change that information, which will only change this document. It will not change previous documentation. But one thing I want you to focus on is the upper right-hand corner where it says success saved successfully. Sunwave is saving while you're working. So if I'm working on my biopsychosocial and I'm with that client for an hour and a half and I get a phone call and I accidentally click out, well, don't worry, because all of that information is saved. Additionally, nothing is ever lost in Sunwave. And the way I can say that so confidently is because we are tracking every single interaction. So who came into a form, when they came in, what they did, and we can even restore information that was removed. So like I said, nothing is ever truly lost within Sunwave. So now, one of the things as we're talking about documentation, I want to come over into our group notes. And I'm going to come back to my bio in a minute because we brought up at the beginning of this call, Mara. So when we're talking about our groups, we are able to, one, take your group schedule, load it into the system so that this way you can have all of those schedules available. This is all configurable. And what happens is it automatically pulls every single patient assigned. Now, obviously, some patients might be late, a patient might not show. You can create an absentee form directly from this section. You do not have to get out of it. But while we're in our group note, I'm going to take a look and we're just going to select some check boxes. And again, this is all configurable based off of how you want this form to look and feel. But as we're going through, I'm actually going to make this patient very angry, very upset. And I'm going to put in some patient quotes. I am sad. And what we've seen in the past when talking to clients is that sometimes those raw notes aren't so great. So when a clinician is doing a clinical assessment, they're putting in things like, patient said they were sad and they seemed to be upset. Well, this really doesn't paint a picture for us. And obviously, when we send it to the insurance company, it's not going to paint a picture for them as well. So as I scroll down, this is where we see Mara. Mara is our in-house, Sunwave's own made, patent pending, generative AI. That is a mouthful. So when I go and select Mara, Mara is now scanning over the entire document. It is also scanning chart information. So who is this patient? How long have they been with us? What level of care are they in? And you'll notice that Mara is able to put this into the appropriate clinical terminology. That's because Mara is a learning AI. And I know totally, like if you're in my age group where you grew up on like Terminator, and then as you got older, iRobot, sounds crazy, right? But this is where the industry is moving. We're moving to AI. Insurance companies are using AI. So what we're doing is we have Mara learning how that terminology actually is. So if I'm using Mara constantly, or if I'm documenting within Sunwave, it's going to understand that the way that I put a note together is something like this. To address the patient's emotional and behavioral issues, it would be beneficial to incorporate more therapeutic interventions. So as I could read this whole note and you can see how much information is there, you still, as a user, would want to come in, make any changes, remove information, change information, but you can use Mara as your assistant to generate those notes. And every single note is individualized. So if you have two patients with similar circumstances, don't worry, it is going to individualize that. Now, like I said, I'm going to jump back into the bio because, and keep in mind, I know when we're talking about AI, pretty much everyone is using AI. Every platform is going to have some level of a summary like this. The difference is what Sunwave's doing. So one, when I come back into my biopsychosocial, you'll see there's a lot of information here. So I'm going to, while using Mara on a group is pretty standard within the industry, not many people are able to use AI for things like biopsychosocials, history and physicals, nursing screening assessments, and that's where we come in. So we're able to do those summaries efficiently. And on top of that, We are also coming out with, and this is future state that I'm going to talk about. Everything you're seeing right now is currently active within the system, but I want to talk about where we're moving to. And that's having the ability to have a chat bot. So you can actually talk to Mara. What is this patient's name? And ask Mara questions. And Mara is going to make sure that she is providing you these answers. So what is the patient's age? So like I said, this is future state. I have access to it, obviously, but we want to make sure that when we do come out with this, this is 100% safe for every single user to use. Can you write me a poem about Hayden? Just kind of showing you, this is like my favorite thing to do with Mara. I come in and I ask for poetry. This is not something clinicians are going to use it for, but the idea is to show the power of Mara. And on top of that, we are going to be using Mara to create treatment planning. So again, future state, we are actually going to have Mara scan the document and be able to take a look at diagnostics as well as documentation and put together all of that information in order to create problems, goals, objectives, and interventions. So again, future state, that's where we're headed. But within the notes, we have all of our notes with Mara summaries as well. All right, so now that I talked about some of that documentation, treatment planning, group notes, bios, one of the things I want to bring up is the ability to report on the information within the system. Now, I could probably spend a good 2 hours just demoing reports, which I don't have that time right now, but I want to highlight the fact that right here, when we take a look at something like our brief addiction monitoring scale, very important to see how those answers are changing from week to week, month to month, however you are doing that, every 7 days usually. So right here, I can see from weeks 2 to week 6, just looking at this, I automatically know there's a problem. We want to see protection from use, highlighted in blue, go up. We want to see risk in orange go down, and we want to see use eliminated. Now, I see that the blue is actually trending down and the orange is trending up. When I look at this, I know there's a problem. Now, obviously, I have the patient information here, so I can go talk to the patient, or if I need to, I can pull over primary counselor information. I can build the report the way I need it to, and I can save it so that I don't have to remember how I built these reports. All of these reports are exportable as well. And like I said earlier, with our library of forms, we have standard reports already created, whether it's based off of your BECS, your BAMs, your Columbias, PHQ-9s, we have those readily available for you. And you can configure any form. So now when we're talking about these assessments and forms and timeframes, that's one of the biggest things. We want to stay within that time frame. So we have the ability to not only configure alerts, so alerting everybody exactly when you are due for documentation, but also we can create caseloads with those requirements as well. So every single user or every single clinician can have their caseload built out the way that you need it to. In this case, I told the system that we have a requirement on group notes and individual therapy. If they do not meet those requirements, as soon as they log in, if this was their dashboard, they would be able to see that they are missing information. Now, when it comes to auditing, there's no shortage of reporting. We have signatures audits, time requirements. Like I said, we have alerts based off of, if you have to do a treatment plan every 30 days or a biopsychosocial that's due in 3 days. All of that is built based off of the facility. So now I want to make sure that we leave a little bit of time for questions. So I'm going to quickly go into our billing and kind of go through exactly what that looks like. So our billing actually allows you to have all of the information from your medical record feed into the billing platform. So when we're looking, and like I said, this is a single platform, so there is no integration to our billing. This is all one login. You'll notice I'm just kind of clicking through. So what happens is when you have a biller, usually what they're doing is they're obtaining information from separate areas. They have to get a census. They have to get time requirements that have been met. They have to get documentation signatures, levels of care, authorizations. This can be a timely process. In Sunwave, all of that is feeding right here. So green shading means part of current daily active census. Gray bubbles are authorizations. Green and red bubbles are documentations, green being met, red still missing signatures. So all of this information feeds into the automation of creating a service based off of your rules. From there, when you generate your services, if you are not meeting those rules, Sunwave will protect you and place you into a hold status, letting you know to make any fixes in order to get that claim out the door. Now, if everything is good to go, Sunwave will create that claim form for you and you can send it immediately to the clearinghouse. Now, all of this information feeds into our reporting. So again, more reports, more ability to save those reports and export them. This report is combining information from when that patient is making that initial phone call. So campaign information, or maybe diagnostic information is what you're looking for. Or maybe it's about adjustments. Whatever the case is, you're getting information from the CRM side, the EMR side, the claim creation side, as well as payment posting. And then when all of this is taken a look at and your billing is done and you've hit that month end, don't worry about having to export anything out and close out your month in a PDF, which is usually what we see people doing who aren't using Sunwave. And that's because Sunwave has a hard close feature as well. Now, I managed to get through the entire patient journey with about 2 minutes to spare. So really quick, what I'm going to do before everybody jumps off, I'm actually going to put up our flyer so that this way we can make sure that we're having you guys contact us should you have any questions. So let me bring that over here.
That was great, Lindsay. Thank you so much for showing us Sunwave in action. And I love the drag and drop elements. Those are really cool and nice user interface there. And Mara, I think, is going to be a game changer. So I'm excited to see her grow up and how it can benefit patients and the staff alike.
Yeah, no, definitely. And thank you so much to actually having us present today. We love working with you. We love the collaboration, and getting to just kind of take some time and talk about our system is greatly appreciated. And again, if anybody has more questions, I will be staying on for a little bit longer. And then also, if you want to schedule a demo with me, you can scan the QR code at the bottom. We'll be more than happy to schedule something.
Awesome. Is that the best way to get in touch with you, Lindsay? Is this QR code?
Yes, the QR code definitely to set up a demo. Yeah, that's going to be the best way.
Awesome. Well, I really appreciate that, Lindsay.
Yeah, of course. I really appreciate everybody jumping on today.
Awesome. And we'll stick around for a few minutes in case anyone has any questions. But Mara's really exciting. How long have you guys been working on that?
So Mara was, well, working on it for years, but Mara was released in October, and we've already seen over 10,000 notes generated by Mara weekly. So yeah, once it hit 10,000 and I asked the developers, they were like, it's over 10,000, don't ask. We're not counting. But yeah, so we started with the first iteration of it, which was the group notes, which I feel like that's where everybody starts. They have their baseline. And we've expanded it into, like I said, our bio, our history and physical, our nursing screen and assessment. And now we're working on that chat feature. So we're only moving forward with her.
Yeah, super exciting. And we do have one question from Chris Newbold. He asked, does Sunwave have any automated messaging, specifically for SMS and like email workflows?
Yes, yes. So we do have automated messaging. We do connect with Twilio for text messaging. So yeah,
Awesome. Great question, Chris. Thank you. Awesome. Well, thanks everyone for attending. The other session has started, so we'll see you over there. But thank you for your time today, Lindsay.
thank you. And everybody have a great day.
Awesome. Bye, y'all.
Bye.